Hi everyone, I'm Danielle. So in this video, I'm going to break down what a nurse practitioner actually is, how NPs are different from physician assistants and physicians, and also the question I feel like everyone gets at some point is, why don't you just become a doctor? So I'm going to keep it simple and straight to the point. A nurse practitioner, or an NP, is basically an advanced practice nurse. What this means is we start out as registered nurses first, we work in the clinical setting, and then we go back to school for a master's or doctoral degree to expand our scope. As an NP, you can do a lot of what people think only doctors can do, like diagnosing patients, ordering tests, prescribing meds, and managing both acute and chronic illnesses. But what makes NPs a little different is how we approach care. We're trained from a nursing perspective, so we don't just look at the diagnosis, we look at the whole person. This can include their lifestyles, stressors, support system, and overall well being, not just looking at the disease itself. To answer an NP versus a PA or a physician's assistant, so an NP and PAs actually do a lot of similar things in real practice, and in hospitals, you'll see them working side by side. The biggest difference between the two is really the training model. NPs are trained in the nursing model, which is more patient centered and holistic, while physician's assistants, on the other hand, are trained in more of the medical model, which is closer to how physicians are trained, and it tends to be more disease focused. Another difference is independence. In many states, NPs can practice independently without a physician supervising them, depending on the laws in each state. PAs usually work under a supervising physician or as part of a formal agreement. So they're both super important roles, just slightly different training paths and approaches. So when it comes down to nurse practitioners versus physicians, the biggest difference is really the length and the depth of the training. Physicians go through medical school, then residency, which adds several more years of very intense specialized training. Nurse practitioners will go from nursing school, work as RNs, and then complete graduate school and advanced practice. In day-to-day care, there's actually a lot of overlap between the two. Both can diagnose, treat, and prescribe, but physicians usually have more training in like rare and complex conditions and disease processes and specialty medicine because of the residence and fellowships they choose. NPs tend to focus a lot on prevention, patient education, and managing chronic conditions, especially in primary care and community settings. But they can also be seen in the hospitals. Now, why not just become a physician? So, this is probably the question people are most curious about. And honestly, it really comes down to what path fits your goals the most. For me, becoming a nurse practitioner makes sense because I like the nursing foundation and the nursing model behind it. I like being able to build relationships with patients and look at the full picture, not just the diagnosis in front of me. There's also the reality of time and lifestyle. Becoming a physician is a much longer path in medical school than residency, and that comes with years of intense training and long hours. The NP route allows me to still practice at an advanced level, be independent in many different settings, and get there a little sooner while still keeping that nursing perspective. At the end of the day, it's not really about NP versus MD being better than one another. It's about different roles working together. Nurses, NPs, PAs, and physicians all bring something important and different to the table, and patient care works best when we all collaborate together. So, yeah, that's a quick breakdown of the differences and why I chose this path. Thank you for watching.